And we're live, apparently. Right, this is a hangout I wanted to have to discuss a nuclear criticality, which I had never heard of until about October of this year. And it happened in Japan in 1999 in a place called Tokai-Mura. So I've made a video about the accident, and it's up on my channel, and I'll post the link underneath the YouTube watch link. And I've also posted a link to the original video on G+, along with the link to this hangout and the watch link. And what I'm interested in is discussing the medical ethics of this particular case. Now, while it may have relevance to future cases that are pretty much the same, I think I want to keep the focus on the really narrow on this case because we have all the details. Something that unfortunately the doctors in the case couldn't have. So I've got DPR with me, and I have got Gary Edwards, because I think that, I mean, a scientist talking about ethics really doesn't help. I think DPR and Gary Edwards will have more to offer this discussion than I have. I can't make any decision myself on this. I just can't make up my mind on what should or should not have been done in this case. Now, for anybody who's not seen the original video, briefly, two men were working in a nuclear fuel processing facility, and they were preparing a small batch of fuel for an experimental fast breeder reactor. And they were doing it in the wrong shaped container. And they were also being a tad sloppy in that they were not measuring exactly what they were adding to this container. And they were adding it using a funnel and a bucket. And when the seventh bucket was added, the amount of radioactive material went critical. And when that sort of material goes critical, you get the chain reaction, and gamma rays and neutrons, high energy neutrons, slammed into the two workers. Now, initially, one man had some symptoms which he recovered from within about the hour, but they were taken to hospital. Both of them were walking, they were talking. When they were transferred to the hospitals that ultimately took care of them, they're still walking and talking, they were eating, they were drinking, they were laughing. But the damage that the radiation had done to their bodies slowly manifested itself. And it was basically downhill all the way. Both of the workers had received fatal doses. The fatal dose is about 7 sieverts. One man had received 17 sieverts. The other had received 10. And my video goes into some of the medical details of what occurred to the chap, Mr. Uchi, who got the highest dose. And the question I'm trying to answer is, what should the doctors have done? Did they do the right thing? Mr. Uchi died after 83 days of acute radiation sickness. And my video shows a still photograph taken of Mr. Uchi before he died. And the radiation damage to his body was so bad that not only was his skin gone, but the muscles were sliding from his bones. Knowing that it was a fatal dose, should the doctors have done anything other than palliative care? And this is why I think having DPR and Gary Edwards here is very interesting, because we can get a legal perspective from DPR and then the philosophical perspective from Gary Edwards. I don't want to bring in much about the religious angle of this, because I want to focus on the medical staff and the medical measures that were taken with these two poor chaps, and where the line should have been drawn. So, guys, Gary, you watched the video.
Yeah.
And what is your overall take on that? Given that the last really bad accidents had been back in the 40s and 50s.
Yeah.
So obviously medicine has progressed.
Mm-hmm.
So the doctors were guddling in the dark.
If you've got if you've been exposed to between 1,000 and 1,700 REMs, medicine won't progress that much. These people were certainly in the LD 100 lethal dosage for 100% sort of range, so they were doomed.
Mm-hmm.
I don't think there's any doubt about that. They were doomed.
Yeah. I think. I mean, given the fact that they did both die, I can't really argue with that. I think when you have a patient that comes in that is walking and talking and laughing and joking,
Mm-hmm.
when do you draw the line? I mean, if you know the chromosome studies, they got back the results on day 6. And they'd never seen anything like it.
Yeah.
Now, but still, both of the men were still communicating with staff. So, do you say when you get those results back, oh dear, this is bad, because that's the first indication of the dose that they'd received? I don't think the medical staff discussed, certainly if we concentrate on Mr. Uchi, because more is known about him, I don't think that the medical staff at any point discussed with him what his prospects were. And he expressed the desire to fight it.
So, I mean, one thing that I perhaps wasn't paying attention, but I didn't get from the video was there any dose meter information as to how much radiation they've been exposed to? I mean, how much information about did the doctors actually have to go on?
The only thing they had were the chromosomal studies and the damage of the magnitude that they saw in Mr. Uchi.
There wasn't a single chromosome intact. They were basically all shattered.
Yeah, when they looked at the micrographs, there was over 60 odd separate fragments.
Good grief.
Of chromosomes, and there should obviously be 46.
46, yeah. So obviously this is a lethal dosage of 100% range. So these people are going to die. The process is going to be drawn out, but it is going to be inevitable. So yes, one of the issues becomes, where do you draw that line?
Yeah.
And the other one does become patient information. What the patient has a right to know, what you as a medical practitioner have a duty to tell them. So yeah, there's a number of issues here, which will probably run along the lines of what the duty of the medical practitioner is, and also the consequences of treating or not treating, or any course of action that's taken. So it'll run along lines of consequences and along lines of duties, and those will inevitably conflict in a case like this.
You see, I from the information I've been able to get, the families were warned because there was going to be such a change in appearance. How much the two patients were told, I really don't know. At one point, Mr. Uchi voiced concern that at some point later in his life, this exposure may cause him to get leukemia. And that tells me that he didn't realise
No.
that he'd had a fatal dose. He didn't know what the size of dose that he'd received would actually do to him. The doctors were aware that they'd definitely been exposed to high energy neutrons, which is the worst thing to get exposed to, because of the change of the sodium in their bodies.
Well,
so they knew it was neutrons.
Didn't the place they were working, and there were people who at the place where they were working who surely knew what had happened, and understood the situation. You know what's involved. You know the amounts that's involved. You know what they were doing. You know what they did wrong. Yeah. So surely that information should have come from their place of work. Surely that was there at the outset.
Well, the problem was that their supervisor was also in the room when it happened, at a desk about 4 meters away. So he was the closest. But given that they weren't actually measuring the amounts out in the bucket,
They were just pouring it down a funnel.
they were, one man holding the funnel while the other one poured it in.
Good grief.
To the wrong container. Should have been a long, tall cylinder, because that minimises the chances of criticality.
Yeah.
Instead, it was a wee squat thing. The problem was this, and this is the really horrible bit of it, that basically what they'd done was they'd created a nuclear reactor that was naked. It was unshielded. The whole village was exposed.
Was there a flash of Chernikov radiation?
Yes, there was.
I mean, anybody who had nuclear training would have realised what that meant, because that's.
Yeah.
I mean, a similar accident, of course, happened when they were assembling the first atomic bomb. Yes,
there was two, Louis Slotin and Harry Daghlian, working with the Demon Corps. Both of those men died very quickly. Slotin about 9 days. Harry Daghlian 26, 27 days. So nobody had, and the Chernobyl firefighters, they died very quickly as well, because they didn't realise that while they were standing there trying to put a fire out, they were inside the reactor. So it was neutron radiation that got them. So nobody had actually seen what would happen over the span of 80 odd days. But I think that the primary concern was to somehow, you see, that tank remained in a critical condition, emitting gamma rays and high energy neutrons for something 10 hours.
Good grief.
And that was the first concern. They formed a suicide squad to go in and to drain the water jacket, because the water in the water jacket was reflecting neutrons back in. And so that might have stopped it, to stop the criticality. Much like Harry Daghlian and his tungsten carbide bricks. But they had to get this container out of this critical state, because while it remained in that state, you have got an unshielded reactor. So everybody in the plant was exposed.
It says here in my notes that 119 people received a radiation dose of over 1 millisiever from the accident. So it actually affected quite a lot of people. It's just the people who were in immediate proximity to the tank received an immense dose of radiation.
I mean, the supervisor, who was 4 meters away, he survived. He was out of hospital within a month.
Right.
His blood count recovered pretty quickly, so his bone marrow hadn't been destroyed. And the people in the surrounding town, they were being exposed as well all the time that was critical. Because you have to remember, neither of the two men were contaminated with radioactive material. But the sodium in their bodies became radioactive.
Ionizing, yeah.
Because of the neutron capture. So when they were first admitted to hospital, all the staff were in full protective gear,
Okay.
thinking it was external contamination because the two chaps were radioactive.
So one thing to bear in mind if we're going to sort of try and assess the medical ethics is the lack of information that the medical staff actually had.
Yeah.
They weren't in full possession of the facts.
Yeah. The first they knew that it was neutrons that were involved was when they got the analysis back on various components of their bodies, like the sodium, that the sodium in their bodies was sodium-24 and not sodium-23. That's what told them it had to be high-energy neutrons.
And how long had they been treating them at that point?
I think they had those results probably within 24 hours to 48 hours.
Because that's pretty strong. That's a strong indicator of what had happened. Up until then, they were in the dark. You can't say, or you can't really judge them as if they knew the full picture. But after that, I think it'd be, and if you got the chromosomes as well shattered, then you pretty much know what's happened.
Yeah, well, that was I think day 6 for the chromosomes. So they know reasonably soon that it's neutrons that are involved, but they don't know what size of dose it is, and that's yet another problem. And also the bit that really gives me the screaming abdabs is the fact that all of the time after that accident, while they were in hospital, that sodium-24 in their bodies was decaying to magnesium-24, and it was emitting radiation and probably causing further damage. Although it gets flushed out by the kidneys and it decays pretty quickly, but still it was adding to the dose.
It was accelerating the process. But I think at that dosage, then it is pretty much fatal in the long run. You know they're going to die in the long run.
Yeah.
So after about a week, perhaps, then you can start assessing the medical treatment in terms of them knowing what the situation was.
See, I was looking through this, and I mean the first big indicators that the chromosome study isn't anomalous in any way is the fact that the white counts were affected practically on admission to hospital, and they decreased very, very quickly. So it's various pieces of information coming in at different times. I think if you got all of that information in one go, you take one look and basically say, let's just dig a hole now.
As is often the case, though, if you get all the relevant information in one lump, you're a very lucky person.
Yes.
And I think by the end of the week, they certainly had enough to know what the prognosis was. And then perhaps the ethical issues start sort of like coming into sharp focus, because whatever state they're in, however healthy or what they might look like, there's room for this. They're going to improve or get better. When you know they're not, and you pretty much know what's going to happen, then the issues of do you tell them? Their obligation, your obligation to tell them what your obligation is as a medical practitioner. Is it to reduce harm or preserve life, or issues like that start to come into play.
Yeah,
I don't know what the legal situation is with whether the legal situation would view it in the same way, though.
I know, I have no idea. I mean, it was in Japan, but
there is a cultural thing here as well. There is certainly a cultural thing here as well. I think if you're in a Western liberal culture, which takes the autonomy of the individual to be at the forefront of ethics and medical ethics, then you would definitely, there'd be a much stronger obligation or sense of obligation to telling them what's going on, but it's treating them as autonomous individuals. Other cultures, Asian cultures, which are more communitarian in nature, are less sort of driven to do that as an obligation.
See, I mean, DPR, what would be your take on that? I mean, from the looking at it from the legal position in this country?
Well, I
what
think
would
it's
the
very
legal
interesting.
obligations be for doctors?
Well, I think the legal points are very interesting, and unfortunately I would never profess to be an expert in this field, but I think that Gary just hit the nail on the head, and that is the concept of autonomy. And I don't know to what extent that holds true so far as culture or law is concerned in Japan. We have an understanding, obviously, of the culture of this country because we're from this country, or England or Scotland, the United Kingdom. We have a concept of what culture would determine, and probably also a perception of the legal aspect to it. And that, I suspect, is the same whether that's in Scotland or England and Wales. And I think Gary's right to identify that autonomy is at the centre of the legal framework, and that consent is something that is of particular importance in the legal world. For example, you can't be operated on, say in emergencies, you can't be operated on unless you give consent. But that consent has to be informed. And what strikes me so much about the account that you've given, or the story you've given about these two poor gentlemen, is that on the one hand they seem to be communicating in a position to communicate with their doctors, which, given some of the images, which I have to say are very disturbing and really quite macabre, that if they were in a position to communicate what information was being passed to them, because as you rightly identified, their fate was sealed, and the only thing that, well, one of the things that I find absolutely extraordinary about this case is the number of days it took before they die. I mean, it seems so blatantly obvious that their fate was sealed from the get-go. Well, it obviously was. So what were they being told? And the odd account of one of the gentlemen saying that he was concerned that this may, in future days, give him leukemia. One has to wonder. But I presume that he, or both of them, were in so much discomfort that they were on enormous amounts of painkillers, I presume morphine, amongst other things. And morphine can give you strange sort of like ideas and very interesting dreams. I know that when I once had an operation as morphine for 4 or 5 days, it's quite remarkable. So I don't know what was going on there. The other thing that I would say is that certainly in this country, it's slightly off topic, but you can have you can pre-sign do not resuscitate orders. But in situations where that doesn't happen and a patient isn't in a position to give consent to any particular medical treatment, then the doctors, so far as they can, will then take it on next of kin and family members' views. And from a personal point, I know from very recent experience, that's exactly what happens. So I think there are a number of interesting questions. I think it also sort of like leads on, although I don't want to take it there yet, I think it leads on to issues of assisted suicide and end of life treatment. But I don't want to take it too far off topic at the moment.
I've just looked it up to see what drugs have been given. This is just from Mr. Rucci. He was on propofol, which is a sedative. He started having trouble sleeping around about day 3-ish. That's going to be a lot to do with the fact that, that they're hanging about in a hospital ward. They're not doing all the normal stuff. They're not getting as tired, so they're not sleeping, and plus the worry. So they were getting the sedative. He was getting fentanyl as a painkiller that was constantly being administered IV. That was 200 milligrams per hour. and that's supposed to be about 100 times more effective than morphine hydrochloride. And also, he was being given ketamine as well.
That is a very powerful combination of painkillers.
Yeah. I mean, the amount of fentanyl that he was being given is the amount used during open skull surgery on the brain. But he was responding at that point. But I mean, prior to getting all those drugs, I mean, the pain didn't. I don't think the pain began until the skin started to slough off the hand. That's when the pain began. I think it's swollen salivary glands within the first 24 hours.
Okay.
That were painful, but apart from that, he wasn't in pain. And this is the problem. Worried, but talking and laughing and joking.
Okay. So there does seem to be a period of lucidity. There does seem to be a period of lucidity between the doctors being in the possession of the information as to their fate, and the pain treatment getting to the point where they weren't lucid anymore. There's a period of lucidity where they could have been informed they were in a position to consent.
Yes, and this is the problem, because this is when Mr. Uchi, expressed the desire to fight this. I just wonder how informed he was of what was going to happen to him. And to be honest, I think even the medics just didn't know how this would go.
Well, I think they knew how he was going to go.
Yeah, they knew the route it would go down.
But because research, obviously, there's going to be research having done and evidence available quite easily as to the effect of this sort of exposure. I would have thought the doctors were in full knowledge of exactly what. And I'm sorry to say, you just have to look at the pictures of these people. There was no realistic way that they were ever going to recover.
I must admit, once you get to the stage of those pictures, once you get to the stage of I mean, the picture of that poor man in the bed, you have to say, no, it's just not going to.
Sure, yeah. People who were disintegrating.
Have a good outcome here.
People who were disintegrating are not going to recover. That's So there was no chance of recovery.
We all seem to accept that. We all seem to accept that. So in those circumstances, what is a doctor supposed to do? My argument would be that he or she should do their best to ensure that the remaining part of their life is as pain-free and lack of suffering as possible.
Mm-hmm.
Yeah.
And should they also do they also have an obligation to tell the patient when they're in the lucid stage what's going, the facts, just present them with the facts, that the patient has a right to the facts?
I would say yes.
See, one of the problems
if they're in a position to understand, then yes, there is a duty on the doctor to explain to them.
Okay.
See, one of the problems is this, though, that up until this case, the people were of the opinion that skeletal muscle was pretty resistant to the effects of radiation. So they didn't actually know that the muscles were going to end up sliding off the bones. You know what the sensitive tissues are. It's the skin, it's the bone marrow, it's the lining of the gut, it's the lining of the lungs. Anywhere where there's a high rate of cell turnover, that's where you're going to see the effect. Nobody had ever seen this effect on skeletal muscle, because nobody had ever survived long enough. So did the doctors actually expect that to happen?
Well, if I believe there was some interventionary treatment with one of their siblings with blood transfusions, and they tried skin transfusions, skin transplants.
Yeah.
If I remember from the notes,
Uh-huh.
so they did actually, perhaps you could argue, prolong the suffering. But I think the first thing that strikes me from a moral point of view is the lack of information, the lack of the information being given to the patient when the patient was sentient and could have understood it. That seems to be the first point on which I say they're culpable.
You see, I think the doctors may have thought they could do more than they actually could. But I think, given that nobody'd ever survived this length of time, I think the doctors were pretty much in the dark as well.
Mm.
I mean, the communication stopped with the patient around day 10.
So that's like,
that was when they had to intubate.
that's 3 days after they knew what was going on. There seems to be a 3-day window in which they could have informed the patient, and the patient could have was being communicative, could have expressed the wish as to basically whether they wanted to be used as an experiment in this way. You know, this may not be an ethical way to find out the effects of high doses of radiation on skeletal muscle. So this to me strikes me as the moral point, and I think DPR would agree it's the primary legal point as well.
Yeah, and the only reason that they intubated the chap was because he was having pain when breathing, and by the time they got the go-ahead to get the drug that they wanted to give him, he passed the point where he could swallow the oral form of the drug, and only the oral form was licensed for use in Japan. So and also I think they were looking at possibilities of a blood clot somewhere in the respiratory system that was. But I think, given subsequent events, I think it's apparent that it was the muscles becoming inflamed as cell damage began to manifest itself. But the doctors just weren't aware of this because they didn't expect this muscle damage. So you're talking about the muscles in between the ribs, which are used to aid breathing. The doctors weren't aware that there was a chance the pain was coming from that, because they were unaware of the effects on skeletal muscle. They were becoming aware of the effects on muscle, watching it happening. So they didn't, in a way, the doctors weren't fully aware of exactly what was in store for the patient.
How bad it would get? No, maybe not. They knew it was going to be terrible, though, and that's something perhaps that the patient should have been made aware of. You know, as our other guest, sorry, I don't know your name, said that there might be some procedure for drugging them unconscious and letting the disease take the course. Yeah,
because I mean the chap was sedated once he was intubated, but there was a level of consciousness at the Glasgow coma scale. He was scoring high, as in you know he was doing okay.
Yeah. I think it's interesting that consciousness, like Christopher just said, it's interesting that consciousness does play a role in our moral evaluation. You know, as conscious suffering is seen as something that one should avoid. One should avoid that conscious suffering because that's particularly bad. But strangely, that argument wouldn't run to them being consciously aware that they're going to die. Maybe have to express a wish to fight it, and I'm going to get this. I'm going to get better. But I just hope it doesn't give me the chemo. Say, no, sorry, I'm afraid you're going to die, and it's going to be terrible. And give them the details. Strangely, the same argument doesn't run to that, but it does run to actual physical pain, consciousness of physical pain.
And
Well, by
I
consciousness,
think,
can everyone hear me?
yep,
Oh, if I can address what Gary just said, by consciousness of physical pain, don't you just mean pain perception, right? And that seems to be the critical issue. Like if you can perceive pain, then that is suffering, and that's a version of consciously being conscious of pain.
Yeah, yeah. You are in pain, and you are consciously aware that you are in pain, and all the mental anguish that entails.
As compared to the mental anguish that's entailed with being told you're going to die, and
You're going to die in pain, and but it's strange. Under the autonomous model, you still, as an autonomous being, you're still entitled to that information, so that you decide. Your decision is at the center of it, and that seems to be the principle that where the medical treatment can be held culpable is its lack of treatment of the patient as an autonomous being.
I'd also.
yeah, I think for me, sorry, Becky.
Oh no, that's okay. Yeah, you can
you
call
go,
me
love.
Becky or Jade. My real name's Jade. The Becky's a different, like a nickname. I also wonder. This is not something I know much about, but another potential possibility would be to even block the nerve signals from going to the brain, either drugging someone so that they had no clue that they were in pain, or finding some way to block the nerve signals to the brain that so they could still be awake and alert, but they wouldn't feel anything.
Sure. I mean, in this case, obviously, you'd have to block it at the brain. You couldn't block it where it's happening because it's just so universal.
Right.
So yeah, it's basically unconsciousness. It's inducing unconsciousness. And if you're in a position where you know that's going to happen, you know you're being killed because you're never going to wake up.
You see, another one of the problems was that drugs were being administered via a line that had been put in. They were very worried about any medical procedures. I mean, at one point they were trying to drain some fluid from the pleural space, and they were really, really worried because the hole made by the needle might not close. Because the chap couldn't heal. And one of the Russian doctors that was imported to have a look at them suggested amputation of the right arm because of the muscle death there, which was affecting the kidney. But then they all realised that if they did that, the stump wouldn't heal. And the guy would bleed out. So they had to be very careful about anything that was invasive. They couldn't even take a gut biopsy because I think that had been done with one of the firefighters from Chernobyl, and he had bled out from the biopsy site. So there were quite a few procedures that they just couldn't do. And somewhere in all of this treatment, the goal changed from improving the patient's condition to trying to keep the patient stable. And I don't think that was a conscious decision by the doctors.
Well, it's forced upon
that was just
circumstances.
The way it worked out. Yeah, they were at first they were trying to be proactive, but then they were just playing catch up.
That's a strange way to act once they knew what the situation was. Once they knew what the situation was, I think the issue to me, what it strikes me as is, I don't know what the legal point of the situation here would be. Is it admissible to euthanize somebody's consciousness, and to render them unconscious and an unconscious state from which they are not going to re-emerge, in order to shorten, so they're not consciously suffering as conscious beings. What's the situation with that? And then, of course, that's different. That's different to killing them. You can put people in medical comas. You can put people in unconscious. It's different to people killing them. But would the moral thing to do perhaps have been told the patients the situation, and put them the option that this is what we can do, because we know that if you remain conscious, your fate will be agony. I mean, it'll be it's a nightmarish death. You wouldn't use it in those terms, obviously, but you know, you'd make clear that that's what's going to happen. And then you euthanize somebody's consciousness. Yeah. Now, if you've done that, what is there? What legal protection is there for what remains, which is this disintegrating body that is no longer a conscious being, or has any potentiality to be a conscious being, given the inevitable physical outcome?
I think the legal issues would be whether the doctors were acting in the best interest of the patients.
Yeah.
Which they are entitled to. Many sites I've been looking at. The one I have in front of me now is in relation to consent to treatment, which this is from the NHS guidelines. And defining consent, it says it ought to be firstly voluntary, secondly informed, and thirdly that the person have capacity to give consent. Now, the interesting question comes where they don't have capacity to consent. Let's say that they are in a coma or whatever. And in such circumstances, other people's views should be taken, including the family. But it does allow for doctors to act in the best, their view of the best interests of the patient. Now, in relation to long-term comas, it's difficult to argue that it's acting in their best interests. Family members normally intervene at that sort of level, but in situations such as someone coming in having been involved in a traffic accident, unconscious, then you know the question doesn't seem to be a difficult one to address, does it? They're going to act if he's given consent, because they believe that it's in their best interests, and most people want to live and be made better, so that's not going to be an issue. I suppose where the difficult issue comes is where there are no relatives, the person is unconscious, and clearly, in the view of the medical experts, is in a degree of discomfort or suffering, and they know that by relieving that suffering, by inducing ever-increasing quantities of morphine, they are effectively going to bring that person's life to what would arguably be a premature end.
Sure.
Should they face legal consequences as a result of that? I think, provided they'd acted with professionalism, considering the guidelines that have been laid out, I don't think any criticism should be made of a doctor that seeks to allow someone to die with as much dignity as they possibly can, and in the most painless way in which they can.
Isn't this a little bit where legal definitions of being alive and being dead kind of have to jibe with medical and scientific definitions of the same thing, so that for there not to be a legal case made against somebody doing something unethically or immoral or whatever legally, it also comports with, you know, scientific definitions that the medical practitioners can adhere to.
Yeah, I think it'd be interesting as to what we can say constitutes a capacity for autonomous judgment, what constitutes a capacity to consciously experience pain. Now, I think that I don't know what kind of definitions there are in law to that effect, but it might be interesting to see what the relationship is between our scientific understanding of those concepts and how they're understood in the protocols that are used in cases like this. Because it might be interesting to see when is somebody capable of judgment? How do you judge that? I think there are some, if I remember dimly, there are medical tests that sort of basically can test for this. But I don't know how subject they are to revision in the light of further research, or what kind of conceptual basis they have as they're currently constituted. But these are interesting questions, and these are perhaps where our scientific understanding of these ideas could inform legal and medical practice.
One of the points that I think was a turning point was, I think, day 59. That was the cardiac arrest. 3 cardiac arrests in 40 odd minutes. Just check what day it was, actually, because I think it is important to know what day that was. 59. Yeah, it took them 49 minutes to restart his heart.
What was the point? The point being, what was the point? I mean, we're long after the point in this terrible situation where autonomy and consciousness have fallen out of the picture. It's almost like they're being kept alive for the benefit of the medical scientific evidence that's coming from this peculiar case.
Which brings up the point of coercion, right? Depending on what the protocol is, if that's not what the patient wants, and the medical team is coercing them in explaining things to them towards a specific way of going forward with treatment, right? And this is kind of where consent to participate in research kind of overlaps with consent for treatment, because you kind of need to be told the risks and the benefits. You need to not have undue influence, I think is the proper term, or it might not be, but you also have to prevent coercion. So if there's a protocol in place that somebody disagrees with and you are coercing them towards it, is that really consent to that treatment?
No. And the thing that I think the thing that stood out most strongly about this case is that lack of lack of interaction with the patient. The treatment, the lack of seems to be a 3 or 4 day window where the patient could have been consulted and told, and this they could have their right to know what was going on and decide for themselves was overlooked, and I think that colours pretty much everything that comes after. From at least from a deontological point of view, from a point of view of a morality that's based on rights, obligations, and duties.
Yeah. And I think on the day that the cardiac arrests occurred, that was the last day that Mr. Uchi showed any sign of consciousness.
So he was conscious all that. So there's a potential that he was conscious for many weeks while undergoing this deterioration. You see, that in itself is probably morally remiss, because that's a bit like prolonged torture. You have one of your duties you have as a doctor, I'd imagine, besides your duty to respect the autonomy of the patients, is you have an obligation to minimize suffering.
Yeah, and I think that's why they were using such high levels of painkillers, because every single day they had to change the dressings on his skin. And it took them 2 to 3 hours. And I don't know if you know it, but the pain from burns is one of the most intractable pains. It can be one of the most difficult to control, because the nerves tend to be hypersensitive. But one of the reasons they really had to do this was because of the bone marrow suppression and because of the loss of skin and the chances of infection. And also because they had to weigh the dressings to find out how much fluid he was losing, so they could replace it.
But what's going on here is they seem to be studying. They seem to be involved in the study of this as if it's some kind of case, and we've come to the point now where there's acute suffering. There's acute suffering, and it's prolonged. Now, I think one of the things that often happens.
Are we? One second, Gary. Are we able to say that?
Well,
People so pumped up with painkillers and other drugs, which basically relieved the pain and sent them into a state of unconsciousness. Well, to say there was suffering.
Well, if we're going on the honest claim that this was the last day that this gentleman exhibited signs of consciousness was the days of the heart attack. Then there was a significant period of time up between before then where there was acute suffering. I think the skin and the muscle started detaching before then. So there just seemed to be a period of time where there was acute suffering and the possibility of consciousness in some form. Maybe obviously it's going to be intermittent, but it's acute consciousness and suffering and intense pain at the same time, and prolonging that in itself is a moral issue.
Mm-hmm.
This is where this is.
I think there's another one as well, isn't there, Gary? If they were convinced that any form of suffering was no longer extant in either of these poor gentlemen. We would be repulsed at the idea that they could carry on treating them on some sort of medical basis, even though that they knew they were unconscious and feeling their pain, on the basis that it was some sort of experiment, so perhaps we'll get a better idea of what to do next time. We would all be repulsed by that, wouldn't we?
We certainly would, yes.
Why?
Yeah.
Why?
Again, it's because I think a lot of our moral thought is empathetic, and we project ourselves into that situation, and we think what we would like. So we are projecting something of our autonomy into that situation, and it is I think we instinctively appeal to the idea of minimizing suffering. That we see as something of the obligation of the caregiver.
In the hypothetical I was giving, there is no suffering. I for some reason, I go back to the idea of consent again, because obviously people can give consent to their bodies being used after their death for medical experimentation or whatever, donations and whatever. So does it somehow go back to consent again?
Yeah, I think this is the key point in this case, and cases like this is under sort of duty-based ethics is that issue of autonomy, consent, information, and treating the person with respect as an end in themselves and not just a means. I think that's the key point in cases like this, and I think the failure in this case to do that colours, like I said, colours everything that comes afterwards under this kind of moral system, under a duty-based moral system.
I think one thing to bear in mind, I think somebody touched on this earlier, was cultural difference. And I do believe that in Japan, losing a patient is considered a shame for a doctor. Now, don't quote me on that. I just remember reading that somewhere. But that may have had a lot to do with it.
Well, depending on circumstances, losing a doctor, losing a patient can be a shame to a doctor in any culture.
Yeah.
I think specifically in the case of, see, we like to think that our liberal values are universal, and our liberal values, especially in respect to law, are very much based on duties, obligations, and personal autonomy. Different cultures have slightly different views on this. Some of them are more communitarian. They'll think more in terms of social context and sort of honour and reputation and things like that. And I think that does come into play. And whilst, yeah, it's perfectly true, Japan might have a legal system quite similar to America's in some respects, given the Second World War, the outcome of the Second World War. I still don't think you can really universalise and expect everybody to conform to the same universal sort of moral values on this, and that might have come into play. So again, this is an issue. How do you judge people who don't necessarily share your views as to the importance of autonomy?
Yeah, I'm just
I
looking
don't know what
something up.
DPR thinks about it, because I believe you have some interest in international law, and I'm like, is that an issue when it comes to international law?
My interest in international law is purely based in humanitarian law, the law of war.
Oh, I see.
It's not that sort of international law. As I say, I can't comment in any detail at all about what the law is in Japan. But I can understand there may well be cultural differences. I find it odd to, kind of in a way, to say that for a doctor losing a patient is some sort of embarrassment, because we're all going to die somehow. In some way.
Ultimately, it'd be the most embarrassing profession in the world, wouldn't it?
Yeah. Now I've just come across something that is really interesting, and I think is very pertinent to the discussion. One of the ominous signs when it comes to exposure to radiation is bleeding from the gut, and that's basically a sign that says you're for the off. And Mr. Rucci didn't have any bloody diarrhea at all until day 50. 50.
Yeah, but there were other signals long before then. By day 50, they knew what the score was, and that anomaly. Well, you know what data sets are like. Anomalies happen.
Yeah.
But
and they'd also seen some signs that there may have been some skin regeneration at the edges of the area that had sloughed off.
Yeah, but even that, given the larger data set, given the largest picture, that doesn't count as significant.
Yeah, I think.
Do you think, given them the best view that you possibly can, do you find it in any way conceivable that the doctors were acting in the best interests of the patient in this specific that you've raised?
I think that's certainly how they started out. And I, from reading the statements of the staff that cared for him, that's the nursing staff and the doctors, the impression I get was that as they began to realise the hopelessness of it, nobody wanted to be the first one to put it into words for the sake of the team.
For the sake of the team.
Yeah, because one of the problems was that given that it was a dedicated nursing team around him and medical team around him, they had become, they'd come to know the man. He wasn't just a faceless patient. They'd actually come to know him. And they did really, really want to do the best they could for him. And the job of a nurse in an intensive care unit is to care for the patient in such a way that the patient's best interests.
Sure, but best interests and compassion aren't. Compassion doesn't affect the actual likelihood of the outcome.
Yeah,
so there's a mismatch. So it's understandable that they invested a lot of hope in a better outcome, but hope, as we all know, doesn't influence facts.
Yeah, and because I think.
Well, some of us know that.
Certain members of the team, the nursing staff especially, who spent day in, day out with them, are still years later suffering the trauma of that case.
Sure. So here again, an interesting issue here which comes up for me is that are those attitudes the kind of attitudes you'd attribute to what you consider good or virtuous medical staff? Because in a sense they are, but in a sense they're not. You want people to care, but you also want them to show a certain level of professional detachment, so as that they can care better, if nothing else.
But then again, you've got to remember that these staff were actually seeing something that they'd never seen before, that no amount of training can prepare you for.
Sure, but curiosity can be a vice in that situation because of it might not work in the patient's best interest.
And see, initially, I thought to myself, they just did this guinea pig collecting data. But I think certainly from the beginning, that wasn't the case. They really wanted to see if they could save these men, because they weren't old men.
No, I've seen the photos. I've seen the photos. They were young, fit, healthy men.
Yeah, one was in his 40s and one was in his 30s. Mr. Uchi had a son who'd visited him in hospital at the beginning. And I think the staff were determined to do the best for these patients, to pull them through this. But where I think, because it's not a sudden realisation, it's almost like a spectrum. And so there isn't a line that you cross. It starts off with a little niggling doubt, and then a little bit bigger niggling doubt, and a little bit bigger niggling doubt. I think that's difficult, and of course.
But that wouldn't perhaps be the best way to. If you're faced with a man whose chromosomes are in 60 pieces,
yes,
there's a pretty good reason to jump to a big doubt pretty quickly.
Yeah, that and yet again, I have to go back to the fact that the medical staff had very little data to go on.
Well,
because
initially,
really big accident.
Well, initially, but I think after 10 days, the picture was complete enough. If they'd been epistemically responsible, if they'd been responsible enough with regards to what they know, then I think if they'd adjusted their doubts accordingly, they would have had a window where they could have told the patient, and they could have handled it, and they could have done other things to handle it better. And so the failing here seems to be not only one of violating their duty to inform the patient and respect their autonomy, but also not evaluating the evidence that was put forward, not accepting what was rationally entailed by the evidence they had.
Yeah. See, I know that we're talking about the doctors as doctors and the nurses as nurses, but then there's also the humans as well.
Sure, yeah.
And I think confronted with such a horrific case, are they able to stay detached?
It's not so much a catch of detachment, because detachment will not make you a good caregiver, I don't think.
Yeah, no, that's true.
You know, but it's more a case of the virtues that you'd like to attribute to a proficient caregivers, which is a respect for the facts of the situation, and as well as the values that are involved as well. You know, so you'd want, once the picture became scientifically clear what had happened, that presented, whilst the patients could still have been respected, a window of opportunity to fulfil their. Of course, we're talking from our Western perspective to fulfil their duty to obligation to the autonomy of the patient, which then wouldn't have coloured the rest of the events in quite the way, quite as badly as it seems to us looking at it from our Western perspective, in retrospective, if you like, back in history. So I think maybe there's some failure to respect the facts of the issue.
Yeah. You see, I suppose if his other systems had begun to shut down, you know, multi-organ failure, etc., then it would be an easier decision to make. But in fact, it wasn't until after day 59 in the cardiac arrests that his kidneys shut down and his liver started to shut down. And that was nothing to do with the radiation. And because they had been starved of blood during that 49 minutes when they were trying to restart his heart.
Okay.
Now, to me, that point right there is I don't think they should have restarted his heart.
Well, what
let me pose this question, if I may, because I'm interested. You mentioned the fact that the nurses had commented on the treatment that he was receiving. Did any of the doctors comment on it? Because before it's very easy to stand back and in hindsight criticize other people, but before I can say that they were not acting in the best interest, in their understanding of the best interests of the patient, then I would have to know, for example, that they knew ongoing treatment was just prolonging unnecessary suffering, or they knew that there was absolutely no way these two people were going to carry on surviving, suggesting that they were.
Would they have to know, or would they have to have reasonable grounds to know?
Which I have trouble with the fact that they weren't aware of what was going on.
Sure.
But if they were acting with ignorance and not with certainty as to the outcome, how is it that we can say that they were morally wrong in what they did?
Well, would they need to actually know, or would they just need to have reasonable grounds, or that if they were competently assessing the data, which is part of their job, they'd have reasonable grounds to know.
Knowledge, and I accept knowledge is going too far, but reasonable grounds to believe that what they were doing was going to have no significant beneficial outcome.
Sure.
How about that?
Yeah. Because, I mean, I think, as I said, if organs had started shutting down, I think the doctors would have acted completely differently. But all the signals that the main signal that you're supposed to look for, which is bleeding from the gut, didn't even start until day 50. That's supposed to be the indicator sign.
Do you think that they were so thoroughly invested? I mean, that did start, okay?
Yeah, started on day 50.
And if that's the only sign you're looking for, given the fact that you can see the obvious physical deterioration of these people, and what seems to me, from my limited understanding of it, the inevitable consequences, then what are you saying they should have done to gone to effectively end-of-life care and made it as painless and dignified as possible, or to stop trying? It seems to be suggesting they were trying desperately to keep them alive, and I don't know, maybe I've misunderstood you, but I got the impression you were saying these are desperate attempts to keep them alive at whatever costs was the issue you had about their treatment.
Me?
Yeah.
Yeah. Yes, because I think, I mean, hindsight is 2020, and to be perfectly honest, given what we know, I think you can say palliative care from the get-go.
Well, at least from a week in, when there was a significant amount of information to suggest what the outcome would be, even if they weren't bleeding from the gut, or there were signs of a small amount of.
What do you reckon to this position? I struggle to concentrate exclusively on the problem that you've outlined, Fiona. But if you want to stick with it, then so be it. But I'm looking more generally. bring it back to the specific if you want. What do you think the doctor's position should be if the patient is no longer in a position to give informed consent, yet the family are saying, do everything you can? The doctor is fully aware that doing everything you can is going to cause pain and suffering. He explains this to the family, and the family say, no, we want you to carry on as best you can, however much suffering that involves. How do you view that sort of dichotomy of interests?
I think that the doctor's loyalty should lie with the patient, and the doctor
I might
should
have an issue with you in that regard, because I think the doctor's fundamental priority ought to be the patient, and I think that if relatives,
that's what I just said,
whilst genuine but perhaps overly emotive input is going to cause the doctor's patient suffering, then I think it puts the doctor in a very, very difficult place.
Oh, it does. It does.
And as I say, I don't know what the conclusion would be, but my sympathies would be with the doctor. If I was a doctor, I would not want to put a patient through unnecessary suffering, however much the relatives were yelling at me to do so.
I'm agreeing with you on that, DPR. I am absolutely agreeing with you on that. That the doctor's loyalties lie with the patient and not with the patient's family.
Can I offer something?
Mm-hmm.
Well, but just before you do, I think just before you do, Cliffjumper, I think Gary was just going to address that same point. So if you could let him do that first.
Sure.
Sorry, yeah. It seems to go against what it is. It seems really out of joint. It seems to go against what it is to be a caregiver, to prolong the suffering of the person to whom one is rendering care. It just seems completely out of joint to do that, and it's as if it's not a matter of consent and who's got the legal authority anymore. Like DPR says, it tends to focus more on what it is to be a good doctor, a good caregiver. So the issue becomes almost one of virtue ethics and the character of what we would expect from a good doctor, a good caregiver.
Yeah.
There was something I've thought about. I've got an interest in Japanese things, and one of the things you find with Japanese people is that they are rather more social in terms of this social structure. That although there's a hierarchy, but there's also a team led character in there. If you look at Japanese video games, a lot of them are team related. We're all gonna have to pull our individual assets together and push towards a similar goal. It's it's a sort of greater good kind of idea.
I've got a communitarian approach. About the community rather than the individual.
Yeah, and I wouldn't be at all surprised, given that these patients were told in the initial stages what was going to be happening, that they gave consent to help the medical profession, knowing that they were going to die, that they would be effectively selfless, in giving a universal consent.
Is there any evidence of that, Fiona?
Help further that investigation.
There isn't any evidence that they were aware of what was in store for them. There's nothing conclusive either way, but the fact that Mr. Uchi did express concern that the radiation may cause him to get leukemia in later life suggests that they didn't know that they'd had a fatal dose.
Another thing I've got.
Again, and perhaps Cliffjumper can help me out with this as well, if he's got some understanding of social structure of Japan. Would it be the case that these two gentlemen would consider it a matter of honour or great principle if they died without fulfilling their obligations to their family and other loved ones? Would that, if they were asked in that moment of lucidity, or those days of lucidity that they had. Do you think that they'd be more likely to say, yeah, do everything you can to keep me alive because I've got to look after my family? Would that be a matter of culture and society, in your opinion?
Yes, in a certain respect. I think that they'd be more likely to do it in the best interests of the society rather than the best interests of themselves or their individual family, if they had the idea that this isn't something that they could be healed from, cured of.
But that idea was, we know there was a period of time where the caregivers knew that was false, that there wasn't a chance of them getting better, and yet the patients were in a situation where they could have been told that and could have understood it and grasped the consequences.
I've got another thing as well that I found a couple of days ago, and it's the principle of medical ethics from the Japan Medical Association, and it reads: the mission of medical science and healthcare is to cure diseases, to maintain and promote the health of the people. And based on an awareness of the importance of this mission, the physicians should serve society with a basic love for humanity. Number one, the physician should strive to achieve a lifelong dedication and continuing education to keep abreast of medical knowledge and technology and to support its progress and development. Number two, the physician should be aware of the dignity and responsibility of his/her occupation and strive to enhance his cultural refinement, education, and integrity. Three, the physician should respect the individuality of his/her patients, treat them with compassion, provide full explanations of all medical treatment, and endeavour to earn the trust of the patient. There's six. Four, the physician should maintain respect for his/her fellow physician, cooperate with medical care personnel, and serve the cause of the medical care to the best of his/her abilities. 5, the physician should respect the spirit of public service that characterises healthcare, contribute to the development of society while abiding by legal standards and establishing legal order. And finally, number 5, the physician will not engage in medical activities for profit-making motives.
You see, that's really interesting, because that there is a different approach to perhaps the one that we've been discussing this case under, because that is much more based in one's responsibilities to one's fellows and one's responsibilities to certain expectations of honour and virtue, and it's more a communitarian virtue ethicist kind of approach.
The word that stuck out for me there, Gary, was humanity.
Yeah, and because the one thing, it's a vague term. I mean, when we talk about humanity, we tend to think of it in terms of autonomous individuals. Yeah, the Japanese may not as much.
Yes, that's what I was thinking. Can they have a different understanding of humanity? I don't know.
And that'd be an interesting question, as to try and understand this case, or to see if there's any actual difference there that we could understand that might explain this peculiar course of treatment.
One interesting way of perhaps finding out, and again, Cliff Jumper may not know this, is or any other people on the panel, how the Japanese view end-of-life care.
I'm not sure about.
I'll look it up. I'll have a look on the internet. See if I can find anything.
I'm having a look at Japan's laws on euthanasia, and apparently there have only been 2 cases. One where it was switching off life support, and another one was through injection. But in both of the cases, the doctors were found guilty.
Of switching off a life support under what circumstances?
Well, it was. I'm trying to find out. it's in Japanese, sadly. They allowed a patient to die by turning off life support, and the doctors were found guilty of violating conditions that were set forth in a legal framework. The conditions that have to be met: the patient must be suffering from an incurable disease and in the final stages of the disease, from which she is unlikely to make a recovery. The patient must give express consent to stopping treatment, and this consent must be obtained and preserved prior to death. If the patient is not able to give clear consent, their consent may be determined from a pre-written document such as a living will or the testimony of the family. And a patient may be passively euthanized by stopping medical treatment, chemotherapy, dialysis, artificial respiration, blood transfusion, IV drip, etc.
See, it's times like this you could do with a medical historian, because that's bits of that. So what I was hearing there, I was hearing something, and then there was this like iceberg thing inserted into it, which was straight out of sort of like the autonomous ethics, and then it went back to the other thing. So it'd be really interesting to deconstruct that document and see how historically it came about. Because it is like DPR said. It's sort of a question of what do you mean by humanity? We have a certain view of humanity. We have a certain idea of what it is to be a human being and to be an autonomous, rational agent, and that influences our idea of what it is for a rational, autonomous agent to cease to exist. Mm-hmm. And that comes from our cultural history. Part of it comes from Christianity. Part of it comes from the classical world. Part of it comes from sort of modernist philosophers like Kant. People in a different part of the world may understand the issue differently, what it is to be human, might understand death differently, because they might not conceive of people, of humanity and time in the same way that we do. And these things always sort of like are worth bearing in mind when you're trying to understand a scenario like this, or just more generally how different cultures deal with end-of-life care.
Yeah, and I think one of the problems is that with certain wording in these conditions, in the final stages of the disease, you're going to run into trouble with final stages. You're also going to run into trouble with from which she is unlikely to make a recovery. What does unlikely mean?
Well, it's just likelihood, isn't it? I mean, I don't think that's much of a problem, because generally scientific approaches to medicine are that's their stock in trade is likelihood. That's how you diagnose, and that's how you give your prognosis. It's in terms of probabilities.
I've got something of interest here. It's something I just found. It's a British Medical Journal article, and it's talking about Japanese culture as regard to organ procurement. And there's something in there, it says, and it's talking about the religious elements of things, and of course Shinto is the primary one there.
Yeah.
And it says the majority of the population practices Shinto, which is indigenous to Japan. The preservation of life, the promotion of good health, and the harmonization with nature in accordance with the way of the kami, which are the Japanese divinities, are the three basic goals of Shinto. The principles of the Shinto faith place such a priority on life that the extraction of organs from a donor's body is acceptable as long as it is saving or bettering human life. Otherwise, it's deemed as sacrilegious. Living or donor transplants such as kidney or parietal liver and cadaverous transplants such as skin grafts and corneas are permitted and frequently used. Yet it is because of these same principles that a determination that death has been fearlessly debated in Japan. Shinto followers believe that to declare death while the heart is still beating is premature as well as unnatural. Again, nature is paramount in their beliefs.
Sure.
This is the greatest obstacle in their accepting of brain death, which is absolutely necessary for the transplantation of vital organs such as the heart and liver. But it's just that the bit that stuck out for me is Shinto followers believe that to declare death while the heart is still beating is premature as well as unnatural. And maybe that's what an aspect that's driven the medical procedure here?
I can imagine that, yeah.
It could be. And the one ironic thing is that the only muscle tissue unaffected in this poor chap's body
Heart.
was the heart muscle.
Mm.
And you see, this is why it is a grey area. And I mean, we can say that we find what was done, certainly after day 59 in the cardiac arrest, was prolonging it. But by the same token, although they had to put him on dialysis, he didn't suffer another cardiac arrest. Then again, his pupils were basically non-reactive.
So there was brainstem troubles at that point.
Well, this is the thing, because there was activity. I mean, they're not saying the brain had flatlined. There was activity, but that's the only information I can get. There was activity. It doesn't say what sort of activity. It doesn't say how haywire that activity may or may not have been.
It's in, yeah.
And so that could be really difficult for the doctor, especially with just been looking at that article for active euthanasia. The patient must give express consent. Family testimony is no use. The patient must say, kill me.
What's the position if they're not in a position to give consent?
Then I think you can't do it. That's the problem.
See, for me,
A living will not suffice.
It leads to what would be, in my view, acts of cruelty.
Yeah. It says that
doing your absolute utmost to keep someone alive, even though it's causing enormous suffering.
But it does say that
it cannot be considered to be a moral.
In the case where it would be active euthanasia rather than passive, withdrawal of treatment, a living will doesn't suffice, and neither does family consent.
Which it should.
Sorry, perhaps I misheard what you said initially. I may retract what I've just said.
Yeah. So, and the thing is, a lot of that has been put into place after this case, not because of it, but it's been, since 2000.
Oh right, okay. So what you read out was subsequent to this case.
Yes.
So
this
that bit
that
I said stood out, that bit that seemed as if it suddenly came along like an iceberg, might have been actually as a result of this particular case.
I don't think it was, because most of the language there seems to be describing when patients are in absolute intractable pain. Which, I mean, obviously that this man was up until he had the heart attack.
Well, this raises another issue. If you can mask the pain with drugs, are they in pain?
Exactly. Well, it says you have to have tried. The doctor has had to have ineffectually exhausted every avenue of pain relief. But as I say, this is all has happened after this incident. It's been formulated, and I don't think it was formulated because of this incident. But it's all after this incident.
And quite soon afterwards, within a 2-year period as well, I think. But if you said it was 2000 and this was 98,
well, I'm just saying it was after 2000.
Oh right, okay.
I'm trying to get a date for some of these. I mean, one of the ones the doctors was found guilty in was in 1995. That was an active case. But I'm trying to actually get a date for this lot. They've created, in Japan, they've created what they've called bioethics SWAT teams.
What on earth is one of those?
when a family is faced with a relative in this situation, then it's a team comes in and considers the specific case.
No.
But that's of terminally ill patients. And the problem is this. We can say that someone who's got metastatic cancer is terminally ill. But could you legally make the case, without using hindsight, that this chap was terminal? Because there's no similar case in the history that had lasted that long. And you've got to also remember that his workmate, who got the lower dose, but he lost more skin, his skin grafts took. And what killed him was hospital-acquired MRSA pneumonia.
Why didn't the doctor? Where did the information from the firm, the place they worked? Where did that go? Why weren't the doctors presented with more accurate information more quickly?
Because the procedure itself was, laid out in a protocol of what the men should have been doing. But there was also this thing that was called the shadow protocol, which cut certain corners.
Yeah.
Okay. But the thing was that the shadow protocol would, in all probability, have still been fine. But what the men were actually doing didn't even follow the shadow protocol. And, I mean, Mr. Uchi didn't even know his job was dangerous. This was the first batch of fuel that had been prepared at the plant for 3 years. So nobody had any experience in it.
Mm.
So after the accident has happened, the operators of the plant themselves have got no idea how it's happened. Because they don't know exactly what the two men were doing. They've obviously gone against the rules somehow, because there should never have been a criticality if the rules were followed. But they've got no idea how they've been breached.
I see here that the IAEA said that the cause of the accident was human error and serious breaches of safety principles.
Yes.
Were those responsible for the serious breaches ever brought to justice?
Yeah, I believe they were. In fact, there's another report. There's a big report on this particular accident that is worth reading. You'll get even more medical information than that. I'm having a look to see what happened to them. 6 defendants.
If they have the same sort of system we have here, there'd be not only criminal prosecutions by certain people holding positions within the organisation, there'd also be civil claims as well. I imagine the consequences for both would have been fairly severe.
Yeah, I have no idea about that. But 6 employees were charged with professional negligence. And they were sentenced to between 2 and 3 years each.
When you say employees, you mean supervisors and managers rather than the people who were just hanging the bucket?
Oh, it would be the managerial level.
Sure.
Yeah,
or the
it
director.
would be, because that's where it would come in. The supervisor was in the room at the time. I mean, he got out of hospital after a month, but I don't think he was even aware that what they were doing was as lethal, because he was sitting at a table 4 meters away from the tank. If he knew how dangerous it was, he would have been on a ferry to China. He wouldn't be hanging about.
Yeah, which is why it may not be from a legal point of view correct to put any sort of liability on him. It must come from the board, or as you can always, or in some situations, you sue it or prosecute the company itself, but that it tends to involve prosecuting the managing directors.
Yes.
And it seems to me that those are the ones that should have been prosecuted. And if the result was a 2 to 3 year prison sentence, then I think they got away quite lightly.
Yeah.
Yes, I think they did. Because the safety breaches, I mean, the fact that they were aware that the shadow protocol existed, they knew of the shadow protocol and they okayed it.
Good grief.
And although the shadow protocol would still have been safe, the fact that they were willing to have that shadow protocol and to okay it is a big problem. Because the safety protocols are there for a reason. People don't just make up these complicated safety procedures because they've got nothing better to do with their time.
Let's go and let's have them do this kind of weird thing over here. That'll be good for a laugh. No, this is because this is nuclear fuel. I mean, you know, this stuff can be really exceptionally dangerous, and then people shouldn't.
Yeah.
So yeah, you're right. The moment you start sort of like introducing shadows and sort of giving people leeway, you're culpable. You know, then you know you're responsible for what happened.
Yeah.
So
and the other thing is the slippery slope. Once you introduce one shadow protocol that cuts a few corners,
there'll be another one, and that'll generate.
And then there'll be another corner cut off, and then another. Yeah, exactly.
So the real moral villains here are the people who obviously were in charge of this nuclear plant. I'm going to have to go in a bit, but it seems to me that I think there's lessons to be learned from the medical situation, what happened in that. And I think there was some fault, especially to our eyes as Westerners, with our kind of ethics and legal approach. But what intrigues me, what I'd like to know more about this case if I studied it, would be how different ideas of healthcare are different ideas of what it is you're treating when you're treating a patient. Well, ideas with cultural roots in different metaphysical ideas and different religious perspectives might have influenced this case.
Yeah.
If for no other reasons, it also opens up our eyes to how our heritage and our culture also influences the way we deal with difficult situations, which is always interesting because we're often blind to these things.
Yeah.
We often take them as givens, as just basic fundamental beliefs that are just just given. You can't really question them, and cases like this, I think, open up the possibility that they might not be, and there might be room for improvement.
Mm-hmm.
And it is the kind of thing that illustrates that when you start looking at other societies and how they're different, it makes you realise about your own.
Sure, yeah. This is Heraclitus' point, isn't it? You know, the ancient Greek historian. It comes as a shock to you when you realise how people in different parts of the world do things differently to you, and it does you good to realise that sometimes, because conceit is often a problem. I think some degree of conceit might have been a problem in this case. I think you know they had things in their mind that they weren't questioning, and they thought they were beyond questioning because they perhaps weren't thinking it through enough. And you do. This is everybody gets this. All professionals, all people do. Is you can get tunnel vision.
I can see parallels with this accident with the railway industry. Before British Railways was privatised, they used to have engineers to maintain the track and things like that, and they were highly trained. They had an engineering college especially for railway infrastructure.
Yeah. And it was a great source of pride as well, wasn't it? It was actually, if I remember right, it was a great source of pride to be a British rail engineer. You considered yourself to be something of an elite.
Yeah, and when they dismantled British Rail, the private companies that took over infrastructure, they didn't really worry about things like that. They had the main guys doing the design work. Yes, those were the highly engineered guys, but the guys laying the track were the equivalent of navvies. You know, they literally went to job centres and put in an advert
card as well.
You know,
I think what's instructive as well, just repeating effectively what Gary was saying, that effectively we can come at this from our own particular experience or background. And before the program started, I was thinking more from the legal point of view of the liability of corporations, and I was thinking of the Bhopal incident. I was thinking of the Bangladesh clothing building that collapsed. I was thinking of that sort of like legal sort of like framework. So it's interesting to sort of like, as Fiona rightly put together, a panel of people from different backgrounds approaching the matter from different angles.
Mm.
Well, to sort of go back to what I was saying, though, effectively, the lesson here is that don't you need people dealing with very hazardous materials to be very well trained and understand the dangers that could happen if they're not careful? You know, and when we think about something like Sellafield, you know, and you hear that, you know, they started a reactor because we're a bit low on power and it's got a crack in a wall. And you know, and they're only going to put it at 75% of capacity, you know, and you're thinking, is this a good idea? You know, do we want to stick around with nuclear material just because we've got a short-term power shortage?
Yeah, and familiarity breeds contempt. That's something. I mean, I've learned that in science. That those who worked with radiation very frequently tended to be the ones that were least concerned when they had a spillage and wouldn't clean it up properly. Oh, it's only a wee drop.
Yeah, that's
But the first time you ever work with something like a P32 source, and after you've worked with it for a couple of years, you're working with it like this.
Yeah.
You know, it really, well, nothing bad happened the last time. And while, and given what I was doing with radioactive material, as long as I didn't spread it everywhere, I was the only one affected if I did anything really stupid. But in a situation like this, where there was the potential to have a naked reactor in a town, a naked reactor. You know, you think of all the shielding that you put round a reactor building, and that container was a naked reactor, and it was, I think, 16, 17 hours. It was emitting neutrons and gamma rays. And what were the people told? Stay indoors.
Stay indoors. Yeah.
I'm going to sort of bring this to a close because we've been going about 2 hours. But I think this discussion's actually helped me to reach a conclusion. This is my conclusion, and then I'll ask everybody else for theirs. If the situation, if an identical situation arose, I think the patients should be told, sorry, you've basically had it, and here's what's going to happen to you. And to be asked what sort of measures they consent to, such as fluid replacement, blood transfusion, intubation. I mean, Mr. Uchi didn't have a do not resuscitate notice slapped on him until day 81, and he died on day 83. But I think it has to be informed. The patient has got to be informed what is going to happen.
Yeah. Because
they can't make any decision if they don't know that.
You know, if that
was me, I wouldn't have wanted them doing skin grafts and all these heroic measures. I really wouldn't have.
I'd sum it all up like this, if I just say my last line before I go. Those who are on the receiving end of the facts, who are their victims, yeah, they deserve to know the facts. Yeah. Those who are the other people, the people who are treating the victims, have an obligation to heed the facts.
Mm-hmm.
And I think that's the lesson from this case. I'd sum it up like that.
Yeah, I think that's good. What about you, Cliff?
I think when it comes to a doctor, it's the principle of Hippocratic Oath, isn't it? It's the do no harm, and doctors should act in the best interest of their patients, and sometimes that may be to cease treatment, allowing a patient to slip away as pain-free a way as possible.
Hal, so you've not said anything at all.
Yeah, I came in after the points that I wanted to take up actually happened. So, but I agree with both Cliff and Gary, where sometimes, probably more often than we realize, the best course of action would be to cease suffering, not try and just. Well, I mean, try and prevent it if possible, but at some point you have to realize that this is not going the way we want it to go, and yeah.
And DPR, you get the final word here.
Oh my, put the pressure on me.
It's because George is sitting behind you.
I think it's been a very interesting discussion, and I think that one of the observations that you made from the get-go is that you wanted to keep religion out of it, and I think that by doing so, we've managed to have a very serious and sensible conversation about moral issues, or one particular moral issue. And I think what's instructive is that it's a highly complex issue. It's like many other moral issues. It's an issue that religion is best left out of. It's one that should be addressed by consideration, by deliberation, by debate, by just thoughtfulness, and self-assessing your own opinion on it. And like many moral issues, I suspect there is no right or wrong answer in this case. I think, as I say, it's been very interesting. Is there anything particularly personal? I suppose the one personal thing that I would add to it is that people often criticise the legal framework and law for the position that it takes. I think the law does its best. I don't think that every single time an issue goes to court, we can go into great depth about what is the moral position and what ought the moral position to be. And to just use a slight tangential, but hopefully sort of like an example of this, is that free will is a very interesting concept, but I've never seen a defendant go to court yet and argue successfully that he didn't have free will. He was, we don't treat the world that way. So whilst there are these wonderful philosophical questions, so far as the law is concerned, we have to do our best. Now, in relation to, for example, something that I touched upon very briefly at the beginning, assisted suicide, I think that is a moral issue that ought to be discussed, and ultimately the legal framework should be modified to take into account what I think is a more moral and better position to be in. I'm thinking, of course, of the case of Tony Mickelson, who a few years ago was looking for the legal right for assisted suicide. He wasn't provided that right. Both the High Court and I think also the Court of Appeal said that this was an issue, a moral issue that the courts ought not to get involved with, but the government should, and I totally agree with that. It's unfortunate that as a result of that decision by the Court of Appeal, Tony Mickelson then deprived himself of medical care. He refused medical care and died nine days later of pneumonia. It's unfortunate that the law sometimes has to catch up with a more significant, deeper moral issue than that. But as I say, otherwise I think it's been a fantastic and interesting conversation, and as you said, Fiona, one that is best discussed without religion. Thank you.
Yeah, I think it has to be, because we're trying to look at the best interests of patients and what the medics should do, regardless of what faith they have or none at all. and that's why I wanted to keep religion out of it. I want to thank everybody for coming along. I think, as I said, I've now managed to have clearer thoughts on this issue. I really enjoyed the discussion, so thank you so much for coming along, and everybody say bye-bye.
Bye-bye.
Bye.